easy. Hello guys, coming to you from the pre-op area. I haven't had any medication yet. I was just nervous, maybe a little bit nervous. I got this awesome space age warming blanket on me here. It was really interesting to go through the pre-op as a patient with full awareness, because I'm usually the one pre-oping and post-op, doing post-op on people. So I didn't tell her I was a nurse so that I could kind of get to see how she does it, you know. And I picked up a couple little techniques from her. So there's always something to learn from everybody. Got my IV in and just waiting on the doctor now. So talk to you soon.
You can take them off today.
Hey guys, came out through okay.
Yeah, you sure can.
I'm in minimal pain right now. I had quite a bit of pain medication.
All right, now with your shirt, what kind of shirt did you bring?
A button.
Okay, perfect. Just put the good arm in and just let it slide over like a cape on that side. That'll work. Excuse me, I must be in here for a second.
Oh, we're recording.
Time to go home, baby?
Yes, I'm gonna be going home.
Is it hot right now?
Very humid. I'm going to report.
Buckaroo?
All yes.
Okay.
Well, you two, heading home after the surgery. It's 4:44, so it wasn't pretty much an all-day event, but that's okay. I do feel really good right now. Not from the medicine, but I just feel good. And now I'm gonna get some food. I've had some saltine crackers, which are like literally the best freaking crackers I've ever had in my life. And now we're gonna get something to eat, go home, take a nap, get my foot elevated, or leg elevated, and iced down. And looking forward to seeing how it's gonna feel since these screws are out. And hopefully here's a couple days I'll be able to nix the boot. It's not on all that great right now, but it's because it's got a big bulky dressing underneath there. But hopefully I'll be able to let you guys know how it feels without the screws in there. And yeah, take care. Hey guys, what's up? It's Brandy. I am post-op day 2. The pain is definitely more significant than I had originally thought it was going to be. Yesterday was not pleasant in any way, shape, or form. The previous surgeries, when I took the Norco or the pain medication, I didn't have any nausea or anything like that. I was nauseated from the antibiotics. Well, this time around, it seems that I was getting nauseated from the Norco, but I still needed it in order to relieve the pain, because like I said, it was a lot more intense than I had originally thought it was going to be. So, I talked to the physician's assistant because Martin wasn't able to talk to the physician afterwards. So I called and talked to her yesterday, and they were only able to remove 4 of the 5 screws. The 3 at the bottom, which were giving me a lot of problems, and then the 4th one towards the top, he had trouble getting it out. Had to chip away at the bone, is what she said, in order to reveal the head of the screw in order to get it out. And the 5th one, which was more towards the top of the tibia, she said that it was completely encased in the bone, and so they weren't able to get that one out at all. But that I could expect to have some more pain because of the manipulation of trying to get those screws out, especially that fourth screw. So maybe that's where all that pain was coming from. I do feel better this morning. And I have had a pain pill just to kind of keep it low. My pain's probably about a 3. And so I put the boot on this morning and walked to the bathroom, and it wasn't terrible. It wasn't awesome, but it wasn't terrible either. And here in a little bit, I'm going to remove the bandages, take a look at the incisions, and cover it all up and everything, take a shower, and then redress them after. So I was doing some research last night, just as far as like how long it takes for the bone to heal after screws are removed. I knew if I did the research prior to, I probably wouldn't do the surgery because I was already on the fence about it anyway. Because I just didn't want to be here again in the darn recliner again. Like, I was having like a mini emotional moment yesterday because I was like, this is happening again. I mean, I know it's like significantly reduced as far as like the length of time that I'll have to be here. But anyway, so I was doing research yesterday, and it takes about 6 weeks for the bone to completely heal from the screws being removed. And from what I was reading, just different testimonies and things that every single one that I read was like, I wish the doctor would have told me that you know, he said it was going to be a piece of cake, and you know, I'd be out of work for like 2 weeks. Well, here it is, you know, 4, 5, 6 weeks later, and I'm still having pain and difficulty, you know, with the incisions and walking, and you know, somebody even said, oh, this is very similar to the first time I, you know, doing my PT. I'm like, oh Lord, I can't even imagine that. You know, that first time after my ankle joint hadn't moved, and I was having, you know, I'd sit on the ground in the living room doing my own PT and just crying and crying because I could barely move it at all. I remember the first time when I had a little twinge, little movement in my toe, I was like, hallelujah, oh God, it moved on its own. And so, but I am doing well, and I'm just trying to keep my spirits up and just remember that this is small beans compared to what I've been through, and that I'll be back on my feet in no time, and hopefully with reduced pain. So keep y'all updated, and hopefully here in a little while maybe I can show y'all what these incision looks like. Hopefully Martin will put the pictures of the other incisions in, because they were way more gnarly, and these seem like nothing compared to those. But anywho, peace out. Hey guys, sitting in the waiting room, or I'm sorry, the room to see the doctor, and I wanted to show y'all the sutures before in case they don't let me film it. Looks really good. There's like no swelling. I mean, virtually no swelling, and it's so weird to reach down there and not feel the head of that screw. So I'm really hopeful for how this is going to be afterwards. So hopefully I can film it. Hey guys, just talked to the nurse. She came in, I got my blood pressure and everything, and she said they're going to do x-rays first, see how the bone is healing, and then I'm going to be able to come in. I'll be able to film it. Hey! Alrighty, thank you so much. We'll just left the doctor's office and cleared for work, no restrictions, so I'll be going back tomorrow, and I'm happy about that. I'm ready to get back to work. And so I thought that I would spend this time really quickly to go over with you what happened previously that led to the hardware removal. So in August of 2013, I was hanging curtains in the master bedroom and I fell off the ladder. My left leg got hung in the rung of the ladder, caused the ladder to tip the opposite direction. So I sustained a compound pilon fracture. So the inner bone, called the tibia, it came out of the skin. I did find out later on it shattered into 4 pieces. The outer bone, called the fibula, was a clean break. And so I was home alone when I was hanging the curtains, and so I had no choice but to get to a phone. My phone was plugged in the kitchen on top of a kiosk, so I dragged myself down the hallway and got into the kitchen, used my right leg to catapult myself up to get the telephone. And what I did was I called my neighbor, and she wasn't home because I just wanted someone to be there because I was going into shock and shaking and just sweating profusely, and I knew I needed to stay awake in order to get help, and because Martin wasn't going to be home for several hours. So she wasn't home, and so I hung up with her. They were actually in Galveston, and so I called Martin and I told him, babe, I fell off the ladder and my bone is sticking out. I need you to get off work and come home and take me to the hospital. And he said, did you say your bone was sticking out? Yes. He said, no, you need to hang up with me and call 911. I'll meet you at the hospital. So that's what I did. It took me 4 times to get through to 911. I don't know what was going on with that, but nevertheless, I got a hold of them. They got there. They gave me an IV and gave me some pain medicine. And that is the only relief from pain that I felt until they put me under for emergency surgery. Or actually, until they put me under to put a nerve block in. But the ambulance ride was excruciating. It seems like there's no shocks on those ambulances, and they blew up a little pillow. It's like, look, a little pool float, and they said that was a stabilizing pillow, and it just bounced the whole time, and my foot was hanging off to the left, and so it was just bouncing around, and it was just excruciating. So anywho, I got to the hospital, and they let me know I was going to need emergency surgery. And so when I woke up from emergency surgery, I had what's called an external fixator on. It's an assembly of rods and screws on the outside of your leg that keep your foot and ankle in a fixed position, hence the external fixator. It's pretty gnarly looking. I hope that when Martin edits this video and everything, he's able to insert some pictures for you guys to see. But at that time, they were only able to fix the fibula, and so it had a plate and 6 screws on that side. The tibia, the inner bone, the one that which really took a beating, it was shattered into 4 pieces, and they said that if they were to go ahead and try to fix it, it would be, most people, like 85% of people, will get an infection. And so 6 weeks later, we went in and they fixed the tibia, and they added an additional 5 screws. So I was up to 11 screws and a plate. So about 5 weeks after that, they removed the external fixator, and I was able to start, about 2 weeks after that, I was able to start doing passive range of motion. I did my own physical therapy at home because I didn't have a job, I didn't have any insurance, because I lost my job because I couldn't go back to it, and the FMLA had run out. So I did my own PT at home, and PT, the acronym is, you know, physical therapy, but also stands for pain and torture, because that is a lot of pain. So I was able to get back to work. It's from the time of injury till the time I went back to work was 10 months. and I was able to get back to work, but I'm a nurse, and so I'm on my feet constantly. And so the screws were one of them was very close to the surface, and it had just got to the point where it was very, very painful, and I would have to, I'd be up on my feet for sometimes anywhere between, I'm a PACU nurse now, so anywhere between 8 and 16 hours. And so if I'd get home after a really long shift, I would have to hop to the door because I could not put weight on it after having a dependent for about 20 minutes from, on the car ride home. So that was getting to the point where it's just ridiculous. And, we weighed our options, and Martin really did urge me to get it done. And had he not urged me, I probably would have just been super stubborn and like, no, I'm gonna keep dealing with it. But I've been out of the boot for 2 days now, and I can tell a difference. I was getting discouraged because it just seems still like so painful, and there's still so much swelling, but I can tell a difference. Where that screw was really close to the surface, it used to be a huge bubble, like almost like a half semicircle around it and over it, where there was always swelling, and it was always irritated. And so that's not there, hasn't been there for the past 2 days, and I can tell a difference when I'm walking, and also when I'm doing dorsiflexion. I get more of a dorsiflex, and when I try to crunch my toes, I guess you would say, or squeeze my toes, I can do it without them shaking consistently, because before it was like this and they would just shake like this, and now I can actually do that and it not shake. So I can tell some subtle differences, and we'll see tomorrow once I go to work and I'm on my feet for that entire time, because when we just blow and go all day, there's no sitting. And in fact, I chart with what's called a WOW, workstation on wheels, and I chart standing up, so there's no sitting. So we'll see tomorrow after work how it is, and I'm hoping for the best. So I just wanted to kind of recap for you guys and tell you what happened to me or what I've been going through, and I'm on the up and up now, so I will keep you updated, and hopefully this will solve some of those pain issues and swelling. So y'all have an awesome day. Peace out.